Hello, Dr. Perlmutter. I was wondering what you thought of the evolution of functional medicine in terms of brain health and how it'll affect Alzheimer's, depression, all kinds of cognitive issues in the future.
I have to tell you, Dr. Lee, that's a tough question because so many thoughts come to mind. And, I think back about where we were 20 years ago when functional medicine provided kind of a safe place for outliers like myself to embrace the notion that there were a multitude of factors that were playing upon the brain that would ultimately conspire to cause the brain to decline. And now we're at a place, as you and I had this conversation in 2021, where the notion of leveraging multiple inputs to bring about improvement in brain function is a reality. We just saw the report by Dr. Dale Bredesen using this personalized multimodality approach, systems approach. And that, I have to say that the ground was paved for that to happen through the efforts of functional medicine, not just as relates to the brain, but really in any system in the body that needs attention, basically all the systems. So I think where we're going to go is we're going to see a deeper utilization of software, of data, and certainly an augmentation of the whole notion of personalization in terms of the approach. Not that there is an Alzheimer's drug, but that there are Alzheimer's treatment protocols that are personalized, specifically cultivated for the needs as demonstrated by specific laboratory analysis of the patient who sits across from you in your office at that time. And, let me throw this back to you in the world of psychiatry. Now that you're, deeply involved in functional medicine over the years, how has it helped you thus far? And then after that, the follow-up question, of course, is where are we going? But thus far, what has this type of approach brought to you in terms of tools day to day that you can use in your practice?
Right. Oh, so many. I am in such a different place. I've always been interested in, I guess, other tools other than what, we all got in medical school. And even in medical school, way back, I was interested. But when I first encountered functional medicine, it was right after I left. I was at the University of Illinois at Chicago for many years, and I just got tired of being in their system and not having freedom really to do what I wanted to do. Even recommending vitamin D and omega-3 fatty acids back then was considered like, what are you doing, Dr. Nee? It's like, we don't know if there's enough data for this, So I left and went into private practice. And within a year, I ran into somebody at a conference who mentioned the Institute for Functional Medicine. And I got started learning from you, learning from Dr. Bland, Dr. Hyman, Dr. Stone, et cetera. So many great teachers. And I must say, like, I feel like a way, way, way better psychiatrist. I have so many ways to be able to help people. I still do prescribe. I see a lot of people who are in really acute states, and it's been really, really bad with regards to anxiety and depression, of course, over the past year or so.
I think you bring up a very good point. I think that functional medicine is not going to bring about the instantaneous recovery of problems that, we've always said, well, there's a time and a place for the emergency room. And I think, in the field of psychiatry, there is a time and a place for an anxiolytic, perhaps less so an antidepressant. But what an exciting time it is right now to understand that something as diverse and seemingly disparate as the microbiome in the gut plays a role in modulation of our mood through so many mechanisms, be it serotonin availability, neurotransmitter manipulation, or even, the fundamental role that we've seen in terms of inflammation as it relates to depression. And as such, now that, we gain this understanding that the disciplines of our colleagues are relevant in terms of what we do day to day, that the opportunity arises that these are therapeutic potentials working at that level of the gut, for example, of the microbiome, of its analysis, of its looking at its metabolic products, for example, and realizing that, gosh, your armamentarium has been incredibly increased based upon that level of understanding.
yeah, I'm seeing in the regular literature that they are mentioning the microbiome. They're talking about anxiety and, and dysbiosis. They're talking about inflammation. There's a lot of, there are a lot of studies on inflammation, but still, if you're talking about clinical practice, there's still a lot of catching up.
And you know what? Don't worry about it. I mean, I was we had the institute, we had IFM neurology group, and I was the president and the vice president, the secretary and the treasurer, and I was the only member. So, I know what it's like, and that's okay. I would suspect you're the odd person out, and I've always been that odd person out, and that's what, functional medicine early on gave me kind of a safe place. A place to, that recognized that, we were a bit out of step with mainstream, gratefully. And it really allowed me to understand, that understanding other people's viewpoints from other disciplines really offered me up advantages in terms of day-to-day patient treatment. So, I think that, early on, the mission seemed to be to try to convince mainstream that we had a better way of doing things. And I think from my perspective, it's less about that now. It's more about just using this ever expanding volume of tools that we are getting, now with being able to understand, for example, the roles of various lifestyle manipulations or choices on, for example, DNA methylation pathways, DNA methylation clocks as measured by the Horvath clock, for example, to see in almost real time over a couple of months the effects of our interventions. It's really it's a new dawn, and certainly we had no tools like this back in the early days. And what are we talking about? We're only talking about a couple of decades, but
right.
gosh, a lot has changed since then. So are you much involved in dealing with patients experiencing cognitive decline?
Yeah, and I must say I'm kind of alarmed by the results of this pandemic, because I do have like a couple patients who are already long haulers. I'm sure you've seen that. And I'm very concerned about that contributing to the burden of cognitive decline in this country. I see actually a lot of, there are some Lyme practitioners in this area, and they tend to also deal with mold, and so they're referring to me, and I'm seeing some very, very cognitively impaired patients who are getting worse and worse, or, hopefully stabilizing sometimes, but yeah, some of them are very difficult. And that's a cognitive decline I'm seeing more. It's like from chronic infection, from mold. And yeah, those are pretty sad, because a lot of these people are in their prime and they can hardly function.
And let me just expand on that for just a moment. The idea that the issues that the way that we live our lives earlier in life play out long term, that's been kind of the I think the challenge as it relates to Alzheimer's, because we associate Alzheimer's with old people, and it is something that becomes obvious as we age, and yet again the seeds are sown very much earlier in life. And I think that we're just beginning to get our arms around that, because it's certainly very hard to convince people that what they're doing today may not have an effect on how they feel tomorrow morning when they wake up, but 20 and 30 years down the line, you'll be either grateful or sorry for the lifestyle choices that you're making right now.
I see a lot of people who are in acute states, and so a lot of times I have to prescribe something to bring them to a situation, to a state where I can work on other things like diet, supplements, looking at, toxin load, hormonal balance, that kind of thing. And, sometimes once they're feeling much better, just with a simple, an SSRI or something, because they can work, sometimes they're not as motivated to look at what can I do to prevent other things from happening in the future. People who have a history of depression are at higher risk of dementia, of cognitive decline in the future. So it is difficult, because it involves, like, if I'm talking to them about intermittent fasting or, a ketogenic diet, but they're feeling way, way better already. Sometimes they're not quite as motivated to make those changes. But,
Well, you bring up actually a very good point, and that is, you can reach into your toolbox
yeah.
and if need be, pull out a prescription pad and have the availability to do that, based upon your training and your qualification.
Mhm.
So I think it really kind of frames perhaps a misunderstanding of what functional medicine is all about. It's not all about diet and lifestyle. It's an amalgamation of really virtually every tool that we might think may be helpful in a given situation to bring to bear as it relates to a particular challenge that we have. So I think that's a really very important point. But it seems to me, just in our time together, that you have really had the opportunity to augment the number of tools that you have access to.
I do see a lot of patients, mostly in their 20s, 30s, 40s, 50s. I don't really have like an elderly population in my practice.
Well, I think that's, at least from a preventive perspective, really very valuable that you deal with such a young group. We know that, at least from a bioenergetic perspective, that the changes that take place in terms of glucose utilization in the temporal parietal areas begin in are documented in the 20s and 30s. And
Yeah.
it's no surprise with respect to diet and obesity and insulin resistance prevalence that we are seeing these changes reflected in the brain.
Mhm.
And as such, I mean, the question's often been asked, well, when should we begin a brain healthy lifestyle program? And, I used to say, well, gosh, it's certainly by our 50s. And people thought, gee, that's so early because nobody is having cognitive decline at that point. But the reality is that 2 decades prior to actual demonstration of cognitive decline in terms of a metric, there is evidence of a bioenergetic defect in terms of looking at fluorodeoxyglucose utilization in the brain scans,
Mhm.
showing that these people are destined for, ultimately, the brain has its resilience and also its ability to compensate, but only so far. And
Yeah.
then ultimately, these are the people who decline. And people said, so when should we begin the brain healthy lifestyle? And is it in your 40s? Is it in your 30s, 20s? What about teenagers, adolescents? I think it's prenatal.
Yeah.
I think that we really need to recognize that, something as simple as a decision between having a C-section versus a vaginal delivery has a lifelong importance in terms of the imprint, in terms of metabolic health and levels of inflammation. So, sleep, for example, becomes a huge issue as it relates to the brain. And are you able to engage patients with respect to their sleep habits and make recommendations and help them
Oh,
through
yeah.
that?
Yeah. It's difficult. I'm having trouble even getting my nephew to go to bed at a decent hour and to use, the blue light attenuating glasses, the amber lens glasses, and, to do sleep hygiene. A lot of people just, they are addicted to their electronics, so I'm having trouble with just, having people like just put it away, just try to do something else like meditating, reading something peaceful, taking a bath. Nobody has time for baths anymore, it seems, Epsom salt baths.
We've been exploring that whole notion of noncompliance. There are 3 things that have to happen to bring about change. Number one, we as healthcare providers have to learn as much information as we can. Number 2, we have to then impart that information to our patient. And the big breakdown is number 3, they have to implement.
Right.
And when they don't, then we say you're non-compliant. And what we've come to realize in the past, I guess, 2 years, I wrote a book about it, is that, it's really quite inappropriate to point fingers at patients who then point fingers at themselves when they get home because they can't follow through on the low carb diet or exercise, sleep, whatever it may be. We blame them and it absolves us because we told them what to do. We got to realize that they may not have the cerebral hardware or hardwiring to make that choice, to actually commit to making that right decision, that they're locked into impulsivity through inflammation, other factors that take them away from more sophisticated decision making in the prefrontal cortex. So, we developed a program whereby we don't hit them with a diet at the first visit if they're diabetic or overweight. That's not the way to go. Let's rewire their brains for better decision making by looking at their sleep habits, exercise, stress levels, whatever it may be. When we approach those variables, those on-ramps to better decision making, then we pave the way then for making the better dietary decisions. But you deal with a diabetic comes to see you for the first time, chances are they've been in, however many number of other doctors' offices and have gotten that, list of foods to eat and foods to avoid. They probably have a closet full of those lists and they don't implement because their brains are not wired to allow that. So I think, moving forward, we're really very much involved in exploring how we rewire that whole decision-making apparatus, and as such, offload the blame from the patient, because doctors blame them, they get home, they blame themselves.
Right.
Nobody wins. They end up seeing you because they're so depressed because they're making bad decisions. And then, now it's up to you to try to, help them through it.
Yeah. And when they're cognitively impaired and they have depression on top of it, it's extra cognitive impairment, and it's hard enough for people who don't have any of that to make changes in how they're eating, so you put on top of that a mood disorder and cognitive dysfunction, it's asking too much.
And this creates a forgive the misnomer, but it's a feed-forward cycle, because of that, being depressed, cognitively impaired, under ongoing inflammation, they're making bad decisions as it relates to the foods that they eat, which then leads to higher levels of inflammation, further locking them into poor decision making.
Mm-hmm.
So this is absolutely a feed-forward vicious cycle that we probably are not going to break by simply making recommendations, which are accusatory ultimately, in terms of food choices. That we've got to get other ways of insinuating ourselves into that decision-making apparatus by recognizing that it's stress-mediated, it's inflammation-mediated, and we can target those by getting a good night's sleep, for example, by getting a little exercise. Then people are in a better position to say, okay, maybe I can walk to the corner and maybe I can just not have breakfast until noon, or whatever, you think is going to be the way of changing their nutrition, which then hopefully reduces inflammation, allows them, opens the door to the prefrontal cortex for better decision making. So, I definitely like, as you can see, to reduce things to the, these concepts of graphical concepts that can play out in your mind of doors opening to better decision making. But when you realize that depression is an inflammatory disorder, and that inflammation is affecting the kynureninic acid pathway, therefore compromising serotonin availability, compromising the connection between the prefrontal cortex and the amygdala, targeting inflammation becomes such a powerful tool for mood disorders and specifically for depression.
I was hoping with COVID-19, one bright aspect of that could be that people start looking more into diet and lifestyle and supplements.
The numbers with respect to mood disorders, specifically depression, suicidal ideation, as well as childhood obesity and other issues, sleep disorders, are with COVID significantly increased. And predictably so. That said, I think that the fallout, should this whole pandemic situation resolve from an infectious disease perspective, but the fallout long term, I think, is going to be measurable. And I think people say, well, when are things going to get back to normal? We have to understand that the term normal is absolutely dynamic. I mean, normal is temporally defined, and so. Then the notion of the new normal means what is going on. And I think we have to accept the fact that things are not going to go back to how they were. And in some regards, I think you insinuated that there may be some positives. And I agree that there may well be. I think we've learned a lot. We've learned about the value of connection by being deprived of that. I think we've learned some simple things that we can do work from remote places and still be productive, even in terms of interacting with other people. And that has certainly been positive in terms of the carbon footprint. So there's upsides.
Right.
But that said, I think that stark reality comes to my mind when we think about what does your literature say about the overall efficacy versus placebo, for example, of SSRI antidepressants. And the reality is that in comparison to placebo, there's not much advantage. And yet, well, let me give you another example. Hundreds of millions of dollars are spent in America every year on cholinesterase inhibiting drugs to treat Alzheimer's disease. And yet they do not work. In reality, the largest meta-analysis done on cholinesterase inhibiting drugs has demonstrated that not only are they ineffective, but they actually speed cognitive decline. And yet this is the go-to, in quotes, treatment for Alzheimer's disease in America today, a drug that not only doesn't work, but actually enhances cognitive decline. The work is in JAMA Networks, published by Dr. Richard Kennedy. So, that's what we're up against. And so I think that when we take the step back and recognize what are these fundamental mechanisms that are involved in cognitive decline or involved in mood disorders, we begin to understand that those mechanisms can be approached by lifestyle augmentation or change and other issues, even through medication. Gosh, it becomes such an encompassing and well-rounded approach that how cool it is that people like you are out there looking at that in the world of psychiatry. It just, it's a testament to where we are in terms of moving forward.